Let's Talk Health, sponsored by the Access Health and Wellness Association. I'm Dr. Dan Pavlik Jr. Today we have the Director of Network Development for the Access Health and Wellness Association, also known as AHWA. This is Josh Hill. Welcome, Josh, to the program. Appreciate you being on, man. As we want to kind of get in today to what it is that the Access Health and Wellness Association is, what they can help with from a provider aspect, because that's ultimately the goal here when we talk about what's going on in healthcare, in healthcare today. A lot of issues that we see as chiropractors, and you as the Director of Network Development, going out in the field and engaging with a lot of the different doctors, you are also experiencing probably some of the frustration that's happening today in healthcare. We'll get right into it. The first things first is, as a chiropractor, I've dealt with this, for 18 years, and, we are holistic providers on the alternative care side. And then you've got the traditional medical doctors. How is it that there, I know how it is, but there's that disconnect between the two sides, not with every provider that I've dealt with, but with the majority of providers.
Yes.
So you've got that disconnect between the holistic side and the traditional side of medicine, but AHWA is designed to help bridge that gap a little bit. So, I just want to talk about that a little bit of how this can be accomplished.
Absolutely. And first of all, thank you for having me. I'm excited to be here to share the good story of AHWA. So really, just taking a step back, what we are, Access Health and Wellness Association, is a membership-based provider. What we are doing is connecting the holistic side of things with the conventional side of things, or traditional side of things within medicine. And the idea, just like you said, is to really bridge that gap to make it easier for all parties involved, especially the patients that are coming into your office. So how are we going to do that? We're bringing products, services, and programs into your office as a chiropractor that may not originally be available based on what you're able to provide as a holistic provider. So how do we do that? What we have developed is Access Connected Care Centers. What those are, it's a platform, a digital platform through telemedicine that actually brings an MD virtually into your office so that patient never has to leave your office to get the care that they normally would from a medical doctor as well.
Okay. So patient comes into the office with back pain that we're treating them for and need, some sort of medication potentially, and or something further beyond that, but we basically get them connected with a doctor virtually, and we can make that happen, no muss, no fuss, kind of simplistic, so to say. How difficult is the process of the patient doing that, though?
Yeah, that's a great question, because the last thing we want is to add more work to your plate or the patient's plate, really. So what we're trying to do is really, through the software that we've developed, is make it as seamless as possible, make it as user-friendly as possible, whether it's for your team, your staff in the office, or it's for the patient on the app that we've developed as well to go through the process on their own.
Okay. Well, that's interesting. That actually is extremely helpful, as obviously we typically have to refer the patient out, back to their primary doctor, which the primary doesn't typically want to deal with any musculoskeletal issues, so therefore it goes to a specialist from there, and so on and so forth. So they can
mention there's a chance they might not be back in your office.
They might not come back.
Yeah.
They get lost in the shuffle, they get frustrated, or we kind of all know how that can go as time goes on. Then kind of problem number two that sometimes we can deal with is the insurances, right? The insurance companies, obviously they're dictating a lot more these days. Cost of healthcare is going up. Co-pays are going up. What is it that you guys have created to kind of help with those issues as well? How can we make more cost-effective care happen?
Yeah, really, I mean, it's remaining patient focused. If the patient's coming into your office, they may be paying a copay, but the idea is they should stay in your office so that you're not referring them out and then being charged with a different doctor and then a different doctor. So really, I think we're all well aware of how insurance works these days, but the idea is to reduce the number of times that a patient needs to walk through a new door where they're being charged. So they should receive the holistic service and the conventional service while they're in your office.
So, what are kind of the tools that you guys have that can potentially help with some of these cost-related issues? You know, some of the services that can be done, you know, in general from a standpoint of affordable care.
Absolutely. Right now we have 3 funnels that we're able to provide, but I'll tell you that we're constantly looking for new ways to increase that. But the injury care model is something that we're able to help with. The major medical model is something we're able to help with. And the last piece, which I think most people have been most excited about as I'm out in the field, are the injectables. So thinking about the weight loss programs, B12, vitamin C.
Okay. So weight loss program, semaglutide.
Yep.
Is pretty much the popular program right now. The patient comes into the office overweight, a lot of back pain. They are motivated to try to lose weight, they just can't.
Yep.
So basically, same type of deal. We get them set up on a virtual call.
Absolutely.
They get evaluated. What's the process of you know, if a patient wants to come in for semaglutide treatment, like, do they just put them right on it, or what's the process that the patient has to go through?
There's absolutely going to be the evaluation with the virtual care doctor. Something that we would want to make sure that they felt comfortable prescribing the medicines, that then they would actually take a kit out of your office, go home, and perform the injections by themselves. So they would have the prescription mailed to them, and they would be able to perform it by themselves. I think one thing to note about this, back to the insurance conversation, is these are cash-based programs. So there's an opportunity, you know, to reduce that insurance as being a player in these.
Yeah, it's definitely, and that's going to become more of the normal as time goes on, I think, and it's either going to become where it's not affordable,
yeah,
or it's just going to kind of be there in case you need it. But you know, if people can take advantage of getting themselves better,
yep,
kind of on a cheaper dollar,
yep,
so to say, I think that's a better idea. But tell me a little bit more about the injectables outside of the semaglutide. You know, vitamin B12 is, you know, vitamin B12 and like the immune shots and those types of things. Are those all things that the patient can also get to do on their own at home? Or
it is, yes.
Yeah,
all
okay.
the injectable services will be operated the same.
Okay, and that's all cash based as well. Blood work. Does blood work need to be ordered before doing this stuff, I would assume?
Yes, it would.
Yeah.
And that would all happen through the virtual assessment.
Okay, so good. So everything's going to be managed properly, and the patients will be well taken care of and monitored, so to say, when they're going through something like this. So, okay, well, also very, very good to know that those types of things are happening. I mean, we've utilized some of these programs already, so I just want to make sure that kind of everybody gets an idea of what it is that we're trying to do from a standpoint of just getting patients better overall, because it's just, we're not seeing that. We're not seeing the world becoming healthier, at least our country. That's basically what I'm seeing every day. Our country is becoming more sick and not more healthy, right? So, you know, which kind of leads me right into the next point of chronic disease. I mean, crisis care. It's happening more and more and more. I mean, we see these big hospital systems being built up, which is great. I mean, we're surrounded by Advent Health, we're surrounded by Orlando Health and all these great doctors, but those are growing more and more and more, which only means that what's happening, you know, people are getting sicker.
Yep.
You know, they're needing these facilities, you know, to take care of them. What is it that we and, you know, the Access Health and Wellness Association can kind of do to chip away at that a little bit?
Yeah, absolutely. I think that's a great point. There's no secret. The generations that are coming up, they are more proactive with their health these days, less reactive, fortunately. Everyone's a little bit more concerned. They also know that they have more resources out there. So one of the things that we have as part of Access Health and Wellness Association is Prevention Generation. And this is actually a platform where we can have almost like a social media presence where any of our providers can be a part of this, and they can actually push content out to their patients and the broader community as well that is relevant to some of those diseases that you were talking about.
So let's go into the prevention generation. What does that entail? Like, is that kind of like a search engine for people? Is it more of like a Facebook for doctors? Like, what are we dealing with the prevention generation?
Yeah, let's take yourself for example. If you were to have a profile page as one of our providers, you could upload content onto that page that could be relevant for your community or your patients. All you have to do is apply a simple hashtag to whatever the content's going to be. Your patient would have the ability to follow that hashtag if it applies to them. So that way you're staying in front of them as their doctor, as their provider, but then they're also consistently getting that information as well.
Okay.
The other piece that I just wanted to add on to is we have a monthly newsletter. And we're very excited about this. It's called The Navigator. And this is going to touch on some of those major health issues on a monthly basis that are really, applicable to the entire community.
Okay. So just how long are we talking newsletter wise? Just like a page or two, or
it's a one pager.
And
yeah.
is it more
like
like
newspaper?
Yeah, like my office sometimes we do like whatever the health of the month is,
exactly.
Like men's wellness month, or there's a scoliosis month and stuff. Is it going to be more like that?
Yep.
Is it going to be just?
We definitely want it to be relevant to whatever the time frame is.
What's going on?
Yeah.
And then that'll go out every month, and it just kind of continues to repetitively go on as the years go on.
Exactly.
Okay.
We could provide that to a doctor like yourself, and then you can push that out to your community.
Awesome. So that's all basically now going back to the prevention generation. What's the goal of? Is it kind of unlimited on how many doctors you want to have on here? I know, and there's going to be doctors from different areas. Like they're not all going to be from Orlando. Is it like if a patient were to find the prevention generation and follow a doctor, is that more like kind of the geolocation to where it's like, hey, there's Pavlik's in Orlando, or how does that work?
It could be, but it's endless.
Okay.
We ideally want to have a statewide initiative as we start with AHWA, but this is going to go nationwide eventually.
Okay.
But really, we're focused on the state of Florida, getting 180 access connected care centers, so 180 offices where we're pushing volume into for doctors.
Mm-hmm.
But we're open to having an unlimited amount of offices as part of our network because that only helps the community.
Wow. It's hard to keep up with.
It is. It's a lot, but we're very excited about the initiatives.
Ready for the challenge.
It's a big challenge, but we're on it.
Well, good. I really like the idea of the prevention generation. Where we can build a lot of that just content from a standpoint of, once again, that health and wellness
Absolutely.
side. And it could be anywhere from nutrition to different types of treatment and therapy. And now, are we limited to the type of doctors that are on there? Can it be any type of physician that's on the prevention generation?
Well, we're definitely open to new types, but we want to make sure that we are focused on what's best for the community as well, and what's the most relevant content.
Yeah. Okay. So there potentially could be, you got your chiropractors on there. You could have your nutritionists on there. You could have physical therapists on there.
Absolutely.
At some point.
We have what we call lifestyle partners as well, and
Yeah.
we wanted to be a part of it.
Oh, okay. Very interesting. Well, I appreciate you, Josh. Was there anything else that you wanted to talk about or comment
Not
on?
at this point. I think as we learn more, I'll probably be back on again, but
Yeah.
very excited, and thank you again.
Yeah, you can fill us in on how how it's going, how your momentum's building. But this kind of gives you a general idea of the things that the Access Health and Wellness Association are trying to accomplish. The proof is in the name, Health and Wellness Association. Let's Talk Health is designed to have, all different walks of life, from the holistic world and the traditional medical world, to just talk about what we can do to better not only the healthcare system, but create a better patient-centered model, to where people are being, taken care of much more efficiently. So these are some of the ideas that are going on, that are happening, and we'll talk more about it as time goes on. We look forward to having more and more specialists on as we get further on into this Let's Talk Health program. So we appreciate you listening as always, and we'll see you next time.